Epistaxis. Hi, can I just get you to sit forward for me and blow your nose just to remove any of the clots that have formed today? And now just look up for me so I can inspect the nasal cavities. That's great. Now what I want you to do is just slightly sit forward for me and just compress the fleshy part of the nose just here. And we're going to do that for around 15 minutes. While you're doing this, my partner's going to take a baseline and get an ice pack and put around your neck, which will help vasoconstrict the vessels and hopefully stop bleeding. Also, can I just get you to remove your scarf and maybe turn some of the heaters off, please? While he's doing that, I'm going to ask you a few questions. Are you okay with that? That's great. So how did this start? You picked it. Okay, so when we pick our nose, we usually damage the vessels in an area we call the Little's area of the nasal, and it's a very vascular area and bleeds relatively easy. Do you usually get nosebleeds? No. Okay, that's good. Any recent nasal surgery or basal skull surgery? No. And have you ever had your nose cauterized? No. Okay. So are you on any medications? Mainly anticoagulants like warfarin or aspirin, Pradaxa? No? That's great. On any medications at all? No. Okay. Any allergies at all? No? Okay. So if the bleeding stopped completely after 15 minutes of compression, no other follow-up is required. You do need to avoid hot showers and hot drinks and try not to touch the nose after it's stopped bleeding, and don't blow the nose for as long as possible after bleeding has stopped. Are you happy with that? Okay. So I'd like you at the moment just to stand up and take a couple of steps towards me. Yep. And how's that feeling? Yep. And walking around? Yep. And do you feel okay? Yep. That's great. So it's important to know that if this happens again and bleeding cannot be controlled, it is advisable that you contact your GP for further investigation, just in case, just to be on the safe side. But today, I feel it's okay for us to leave you at home. For me to do this, I need to consult with my partner regarding our non-transport checklist, so I'll do that now. Are you okay sitting there for a minute? That's great. Okay, partner, we're going to check the non-transport pause and checklist. As you can see, we've got a patient here with a bleeding nose. I feel it's due to a minor trauma, due to her picking it. So the non-transport pause and checklists are: the patient has been fully assessed, including a set of vital signs and appropriate investigations. Yep. None of the vital signs are significantly abnormal. Great. Serious illness or injury has been reasonably excluded. Yep. No red flags. So with the red flags, I've checked that she hasn't had any recent nasal surgery, basal skull surgery, and she's never had her nose cauterized before. So I'm quite happy with that. The patient's been seen to mobilize, which we have. The patient and caregiver has been given an explanation of when to seek further help, and a PRF form is complete and a copy being left with the patient, which we will do, and we'll leave that with her as we leave. Are you happy with everything there? Yep. No other comments you'd like to make? No? That's great. So I've just consulted with my partner, and we're both quite happy to leave you at home today. We have done a patient report form, and it just explains on there everything that we have done for you today. So if you need to ring for more advice or need someone else to come around to have a look, you can hand them this piece of paper and it will show what we have done for you. And if everything's okay, we will leave you in peace. Thank you. Bye. Achilles tendon. So what were you doing at the time? Playing touch. Okay, great. And what happened? Okay, so you went to take off and you just felt excruciating pain in your ankle. Yeah. Okay. And did you hear a snap or a crack or a pop or anything like that? You did? Okay. And are you able to walk at all? Only assisted. Okay, no, that's great. I'm just going to examine the ankle, and while I'm doing that, my partner's going to do a baseline. Are you okay with that? Yep. So looking at the ankle, there does appear to be swelling and tenderness over the Achilles tendon. I'm just going to push on the bony bits to see if there's any crepitus, and just let me know if it hurts. Okay, so a bit tender there. Great. So now I'm just going to apply the Thompson test just to make sure it is the Achilles tendon. And for this, I just need you to lie prone on the stretcher, just with your leg hanging over. Yep, that's great. I'm just going to squeeze the calf muscle, and this shouldn't hurt at all, okay? So by squeezing the calf muscle, I found that there's no plantar flexion or movement in the foot or the ankle. So confirming that it is a high probability that it is a ruptured Achilles tendon. So do you have any medical history I need to be aware of? No? And do you take any medications at all? No? Great. Do you have any allergies that you know of? No? Okay. So on a scale of 1 to 10, 10 being the worst pain you've ever felt, what would your pain level be at the moment? About a 5? Okay. So have you had paracetamol and ibuprofen in the last 4 hours? No? Okay. And just let me know what your weight is. 72 kgs? Great. So I'm just going to offer you some pain relief, some paracetamol and some ibuprofen. So paracetamol I'm looking at giving you 1 gram, and ibuprofen I'm looking at giving you 400 milligrams, and I just need to check that with my partner. So if my partner can do a drug check for me. So 1 gram paracetamol, 2016, yep, and 400 milligrams of ibuprofen, March 2016. That's great. So I'll just give you these to take. Here's a glass of water, okay? And also, because I need to move your leg, I'm going to offer you some anti-knocks as well. Have you ever had anti-knocks before? No? Okay, so I just need a few things from you. Can you stick out your tongue for me? Great. And have you been diving in the last 24 hours? No? Cool. And when was the last, when did you last move your bowels? This morning? Okay. And we have no suspected pneumothorax. So anti-knocks is an inhalation analgesic, and its common side effects are sedation, euphoria, nausea, metallic taste, and an auditorial disturbance. So it'll taste a little bit metallic-y when you take it, and also the audio disturbance is like an echo ringing in your ears, okay? But I need you to take a couple of deep breaths just before I go to move your leg, and if you are in any pain, take another couple of deep breaths for me. So I've got my splint organised. It's padded with a towel, and I'm just going to pop the leg in it now. I'm going to pad it out so there's no hollow bits lying around, and tape it down. Also, I'm just going to elevate it slightly to hopefully relieve some of the pressure on the leg. Now, just because I've splinted, I just need you, can you tell me if you can feel this on your feet? Great. And we have a good pedal pulse, and the foot feels warm, and the colour looks really good. So from there, we're just going, we'll need to transport you through to Thames Hospital so they can x-ray it, and if it's ruptured, surgery will be required. And unfortunately, you'll be in a moon boot for up to 46 weeks post-op, and then physical therapy is initiated from there. So if you're happy with that, we'll head off. Cool. Bye. Headaches. Hi, if it's okay with you, my partner would like to take a baseline while I ask you a few questions. Are you okay with that? Cool. So how long have you had this headache for? About 3 hours? Do you normally get headaches? Yep. So this is not abnormal for you. Okay, great. Can you describe to me what it's like? Pains all over? Great. So no sudden thunderclap headache? No. No pain over the temporal areas, like over here? No. No neck stiffness? No. You haven't had any neck manipulation done recently? No. No vomiting? No. Okay, so I've just got a few things I'd like you to do. Can you stick your tongue out for me, please? Great. And can I have a big smile showing all your teeth? Great. And if you just grab my hands and squeeze really, really tightly. Great. Now just turn your hands upside down, closing your eyes and raise to the roof. Great. No deficits there. Are you on any medication? No? Great. So no anticoagulants or anything like that? No? And you're not pregnant? No? Good. No recent trauma to the head? No? No family history of cerebral vascular abnormalities? No? Great. And can I have a temperature, please? 36? That's great. So what were you doing when the headache came on? Reading, studying, exams coming up. Does anything relieve it? When you lie down, okay. Does anything make it worse? Like light or noise? No? Okay, that's great. Do you normally get migraines or anything similar? No? And on a scale of 1 to 10, 10 being the worst pain you have ever felt, how bad is this headache? About a 5? Okay. So this has been going on for 3 hours, and what normally would you do for a headache like this? Paracetamol, ibuprofen. Okay, that's great. And have you taken any of this today? About 2 hours ago. Okay, great. So I can't actually give you any more paracetamol, ibuprofen, because it's contraindicated with us, because its duration is 4 hours. So can I just get you up and stand, and can you walk to me? That's great. So it seems that your headache is due to overreading and worried about studies and exams. So I'm going to put you into our green flag category. And I recommend that it's safe for you to stay home. But if the symptoms get worse or fail to improve, please ring your GP. Okay? So because I'm leaving you at home, I just need to consult my partner on non-transport pause and checklists. So if we can do that now. So I've clarified that the headaches, I've ruled out all the red flags in there and the orange flags. And I'm just doing a non-transport pause and checklist with you. The patient has been fully assessed, including a set of vital signs and appropriate investigations. None of the vital signs are significantly abnormal. Serious illness or injury has been reasonably excluded. No red flags are present. The patient has been seen to mobilise. The patient and caregiver have been given an explanation of when to seek further help, and a PRF form has been completed and a copy left with the patient, which we will do now. Are you happy with that? No other input? Okay, that's great. So we're leaving the patient at home. So we've decided to leave you at home today, and because we've done that, we're going to fill out our PRF form, which is a patient report form. We will leave that with you. So if you happen to ring us again, please hand this over to the oncoming crew so they can see what we've done, or if that fails, take it down to your GP so they can look at it. Thank you. Lower back pain. So what were you doing today when this started? You were lifting a washing basket. Okay, and were you twisting at the time? Yep, okay. I'm just going to feel down your spine while my partner takes a baseline. Is that okay with you? Yep, great. So I'm just going to palpate down, and if it's tender or sore, just let me know, okay? How does that feel? Starting from the top, working our way through the thoracic spine. Any tenderness there? No. What about in the front of the chest? No? That's great. And now working down to the lower. Yep. Tender there. Okay, that's great. Can you describe this pain for me? Yep. Is it radiating down both legs? No? Okay. Do you have any pins and needles or numbness in the legs or feet? No? And is the pain just isolated to the lumbar area? Yeah, and it seems to go down one leg. Okay. Any altered sensation? Yep. And when you're walking around, do your legs feel equal power? Yep, that's great. What about loss of power on one leg? Okay, slightly. And how about in your buttocks? Nothing there? And in your thigh area? Nothing there. Okay, that's good. Is there any abdominal pain or tenderness that you're aware of? No? Okay, so I'm just going to lie you down. I'm going to palpate your abdominal. Is that okay with you? Okay, how's that feel? Nothing there? Okay, that's great. And no loss of bladder or bowel control today? No? Great. And can I have a temperature, please, partner? 36. That's great. So on a scale of 1 to 10, 10 being the worst pain you've ever felt, what is your pain level at the moment? 5? Okay. And have you taken any pain relief today for this? Yep, you have. Some Tramadol and paracetamol? Okay, from the last time this occurred. That's great. Do you have any other medical problems I should be aware of? No? Okay, no osteoporosis? No? And does the pain worsen when you lie down? No? Okay, what about at night? No? Okay, great. Any recent unplanned weight loss? No? Okay, great. Now what I'd like to do is just try to get you to stand. Yep, and how does that feel? Okay, a bit better? Right, and I just want you to start slowly walking around the room and see how that feels. How does that feel? Great. Okay, that's good. So we're not on any medications at all? No. And we don't have any allergies to anything? No. That's great. Okay, so I feel that it's related to the sciatic nerve involvement and that we don't have to transport you to ED today, as the pain or the muscle spasm is isolated to the lumbar area. However, do keep up with the pain relief as you're doing at the moment, and try and stay mobile, as this will help. If symptoms get worse or fail to improve, please ring your GP and make an appointment. As we're leaving your home today, I'd like to consult my partner on the non-transport pause and checklist. So if you just keep walking around, I'll do that now. Okay, great. Okay, partner, so the patient has been fully assessed, including a full set of vital signs of appropriate investigation. Yep. None of the vital signs are significantly abnormal. No. Serious illness or injury has been reasonably excluded. I've been through the red flags and there's none, and also covered the orange flag and nothing in there that stands out. The patient's mobilising and is walking around quite freely. The patient has been given an explanation on when to seek further help, and a PRF form is going to be left with them as we leave. So you're happy with that? Nothing else you want to add? Okay, that's great. Okay, so I've just talked to my partner and we're both quite happy to leave you at home today. Here is a PRF form that we will leave to you, and it explains what we've done today. And if that's all, we'll let you be. Okay, thank you. Take care. Bye.